So now we will get to know how the palpation of respiratory system is done. Palpation it is used to determine the elasticity of the chest, where the elasticity is it is also called as resilience of the chest, and also it is helpful for determining or seeing the rigidity of the chest. So firstly, the elasticity of the chest. So elasticity of the chest is determined by exerting pressure from anterior and posterior directions. So firstly, we have to keep one hand on the sternum and another hand on the backside of the spinal region at the inferior region, lateral surface of the chest, lower lateral surfaces of the chest. So we have to tell the patient to breathe heavily. So by this process we will get to know the lungs, like it's elastic. So for the healthy person, the elasticity of the lungs will be normal as the person breathes. So second, rigidity of the chest. So rigidity, for the person who is suffering from emphysema, the chest increases bilaterally due to ossification of the costal cartilages. And the person, like the patient who is suffering from pleural tumor, the affected chest, the affected side of the chest becomes rigid. So healthy person, neither side of the chest will be rigid. So the palpation used to locate pain in the chest, done by placing palms on the symmetrical right and left part of the chest. So done by placing the symmetrical right and left part of the chest. So we have to say the patient to breathe. So now the healthy patient will be having normal elasticity of the chest. So now we will determine the vocal fremitus. So palpation produced by voice. So vocal fremitus means we can see the voice, which is we can see palpation produced by voice. So it is done in 9 areas of the chest. So first, the region at the anterior region, it is called as above clavicle. This region above clavicle, this is called as supraclavicular area, and below clavicle, this is called as infraclavicular area. And at the level of a nipple, this is called as mammillary area, and below it is called as inframammillary area. So palpation is done continuously, first here and there, like both the sides we have to do the palpation at this regions. This is like vocal fremitus. And at the lateral region, so at the lateral region we have to do the palpation at the axillary area. This is the axillary area, and below the axillary area it is called as infra-axillary area. And at the posterior region, the above the scapula, these regions are called as suprascapular regions. And between the scapula, these regions, it is called as interscapular regions. And here this is called as infrascapular regions. Below the scapula, at the inferior portion below the scapula, it is called as the infrascapular area. So in these 9 regions we are going to do palpation now. The firstly, supraclavicular area here. So the hand should be placed like this. We have to do like instrumental. We have to tell the patient to say 1 2 3. You have to say 1 2 3.
1 2 3.
Say 1 2 3.
1 2 3.
1 2 3.
1 2 3.
And this is called as mammillary area. Tell me. 1 2 3.
1 2 3.
And this is called as inferior mammillary area. So it is done as this. It should be done like this. Like it should be done suprascapular area 1 and 2 here once. The same time at the mammillary area, inframammillary area. At the lateral region, back. At the mammillary region, this is axillary area. Tell me.
1 2 3. 1 2 3.
So at the posterior region, This is called as suprascapular region. Suprascapular region. Hand should be placed like this. It should be done like this. And this is called as interscapular region. And this is inferior scapular area. Like this, the ocal fremitus is checked in the 9 areas of the chest, anteriorly, laterally, and posteriorly.